Hi.
Hi.
Yes, my name is Fidel
Yes.
Giringiro.
Hey.
We are working on World Health Policy project. Here we are going to ask you different questions about global health. The first question is, which is, global health seems to be in the news more and more in recent years.
Yeah.
Talk about what global health is and why it's important to pay attention on it.
Thank you. My name is Emmanuel. Then I'm going to ask you to answer the question you had to ask me. First of all, I can say health. This is a state of complete physical, mental, and social being, and not merely the absence of disease. Then this global health. This is a global perspective on general health issues, proposing issues that are common over the world and working cooperatively to handle and deal with these issues. And it prioritizes on improving health and achieve equitable global health according to the resource called the What's Global Health. Then this global health has many importances to pay attention on it. Then global health has crucial roles in the global security of population. It prevents international spread of diseases and it protects the health population. And it protects transnational health issues. I meant the global health is concerned with all issues of all population all over the world. It controls and assesses health status condition throughout the world by collecting information to inform and to educate and to empower the countries and the community and the people for making changes. It creates and mobilizes partnership with government and non-governmental organizations. These partnerships are very used to mobilize community and improve the health. And it gives information that leads policy, laws, and regulation to ensure enough health treatment. It insists on research and innovation so that they help a global, uh, uh, global health to understand the problems and innovate new solutions and get the way of executing the new strategies so that it can get the best way of intervening to improve health consequences. This global health helps globalization as people are shifting from one place to another, so health and disease become more global. This global health improves development because when people is not free from disease, there will not be any development. So when we improve health, we are improving development. And lastly, global health helps the human right as people have the right to health. Thank you.
Thank you. The second question, as you know, disease come to us in different ways.
Well,
Explain the difference between communicable and non-communicable disease.
thank you very much. As I said, the disease come to us in different ways. Uh, First of all, these communicable disease. These are diseases that are spread from one person to another or one animal to another, but in different ways, such as contact with blood or blood fluids, breathing in airborne virus, or by being bitten by an insect. Those diseases, these are like HIV/AIDS, influenza, malaria, and tuberculosis, according to the resource called the Global Health Topics. And these non-communicable diseases, these are diseases that are not transmitted from one person to another, but they are chronic diseases that are the results of the communication of genetic, physiological, environmental, and behavior factors. Those diseases are such as cardiovascular diseases, cancer, chronic respiratory diseases, lung illness, and diabetes. Thank you.
Yeah, let's talk about Ebola.
Yes.
Since I'm sure most of our viewers have heard a lot about that. What is it, and is it communicable or non-communicable? How does people get it?
Then thank you very much. Ebola is a virus, disease that affects people in non-human, like primates, and the primates like gorilla and the monkey. It's caused by virus with the genus Ebola virus. The source of Ebola is not known, but based on natural similar virus, the scientists believe that it is an animal born in a bat. The bat transmits into to another animal and human. It's communicable disease because people get it through direct contact with blood fluid. For example, in blood, sweat, sperms, vaginal fluid, tears of eyes, or sharing objects contaminated like needles used by someone who is sick or who has died from Ebola virus diseases.
Yes, thank you so much. As the fourth question, what about raise a person risk of getting Ebola?
I can say a person would rise risk of getting Ebola when he often travels in the area of outbreak of Ebola is keeping on. And when a person had contacted a person who is infected by Ebola or Ebola virus, or if he took care of the infected person. And someone who raised the risk for the doctor who is taking care of the patient can raise the risk when he doesn't have adequate equipment that can protect him from being infected. The people who touched on a dead body of person who died from Ebola are high risk to get it. Thank you.
So to prevent or to list the chance of getting Ebola, what should people do?
To prevent the chance of getting Ebola, people should avoid unnecessary travel to the region, area where outbreak is going on, and avoid contact with blood and body fluids like urine, saliva, breast milk, vomit, sweat, vaginal fluid, feces, and semen of infected people or someone who has died. How to avoid the place where burial ritual is taking place in handling the body of someone who died from Ebola virus diseases. And we have to avoid again anything that may have contact with infected person's blood or fluids, such as gloves, bedding, needles, medical equipment, shoes or watches. How to avoid having sex from someone who has Ebola viruses until you know that virus is gone from the semen. Thank you.
The next question, outbreaks such as one related to Ebola can generate a lot of rumors and misinformation and even panic about what the disease is, how it is transmitted, how likely people are to get it, and what about the need for educating people about facts and myths.
Then about these myths and factors, for example, a myth, some people say that they can't get Ebola virus from a dead person. But as a fact, the fact is that after a person dies, the body remains spreadable. Then on a funeral preparation, the handler must have a great attention. The people are trained in handling infected human and wearing recommended protective equipment, should touch or move anything remain that contain Ebola viruses. Some people believe that Ebola virus is airborne as a myth, but as the fact is that virus is spread through blood or blood fluid from person who is infected or die from Ebola virus. It is not airborne. Another myth, some people believe that Ebola virus is not sexually transmitted. The fact is that Ebola is transmitted through fluids like semen or saliva. So unprotected sex, safe sex, in terms of Ebola, because there is a fluid in the vagina which can help transmission. It means that this unprotected sex, this can be a way of transmission of Ebola. Some people say that they can't get vaccinated, they can't get a vaccine against Ebola. The fact is that there are currently no research the Ebola viruses. About 2 potential candidates are under evaluation. Some people believe that there is a cure to Ebola virus. The fact is that uh, there have been many researches on finding the medicine to Ebola, but there is no cure that has been found. There is no research treatment proven to neutralize Ebola virus. Thank you.
Next question. How about the complication that Ebola raises for the right of travelers and responsibility of government? Kachi Hickso, for example, a nurse from Mene who returned to the States following trip to Western Africa in the fall of 2014, promptly had quarantine related to restriction thrust upon her. Restrictions that she was very much against. Briefly describe the difficulty of balancing individual rights and governmental responsibility.
Um, for me, in the case of quarantine, the government has to respect the right of human, but it has to protect the health of citizens from being infected. For example, Catch Hickox was held in the quarantine in a way that is not authorized. First, the government should provide rules about outbreak of any diseases and use the professional people so that people can be in quarantine when the professional have proved that the person must be in quarantine of some days when they are sure. Haki Hickox was held in quarantine, yet she was not showing any sign that should put him into quarantine. So quarantine's right was abused because she was not infected. The right of people should be respected before leaving someone in the quarantine. There must be an approval of someone who is a professional in that career. Thank you.
Yeah. Let's talk about smoking and tobacco user, which is considered a big world health problem. And there is similar issue to Ebola in terms of rights and responsibilities. Just about everyone knows that smoking harms health. What does it do to the body?
Smoking causes diseases and disability that harm every organ of body. Then more than 16 million Americans are living with a disease caused by smoking. Every individual who dies due to smoking, at least 30 people live with a serious smoking-related illness. I can say smoking causes cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary diseases. Smoking increases risk of smoking increases the risk of tuberculosis, certain eye diseases, and the problem of the immune system like rheumatoid arthritis. Thank you.
Thank you so much. The next question, what about second-hand smoke? Explain what is it and how it affects people.
Then the second-hand smoke is the combination of smoke that comes from cigarettes, cigar, and smoke inherited by the smoker. Then every people and children who don't smoke, the second-hand smoke affected them. Second-hand smoke lead to approximately 41,000 deaths among people who don't smoke and 400 deaths in infants every year. It causes strong lung cancer and coronary heart disease in adults. The children, kids who are subjected to or exposed to second-hand smoke are at increased risk for sudden infant death symptom, acute respiratory system, acute respiratory symptom, and decelerate lung growth.
Yeah, as the next question, the last question, people don't typically think of tobacco as a drug like heroin and cocaine, but the addiction it creates is strong, isn't it? Should we think of tobacco use as a form of substance abuse?
Yes, we should think of tobacco use as a form of substance abuse because tobacco products contain the addictive drug nicotine, which can lead to addiction when smoking several times. And the smoker use tobacco regularly because they are addicted to nicotine. People who are addicted are characterized by compulsive drug seeking and use even in the face of negative health consequences. Many smokers would like to stop smoking, but 6% only are able to abandon it in a given period. A transient surge of endorphins in the reward circuit of the brain causes a brief happiness when nicotine is administered. This surge is much briefer than the high association with other drugs. Nevertheless, as other drugs of abuse, nicotine increases level of neurotransmitter dopamine in this reward circuit that reinforces the behavior of taking the drug. Smoking again modifies this circuit sensitivity to dopamine and contribute to changes of other brain circuits engaged with learning, stress, and self-control. For many smokers, the long-term brain changes prompted by kept on nicotine exposures bring out an addiction that includes withdrawal symptoms when not smoking and difficult sticking on the goal of quitting.
Thank you so much.
It's my pleasure, guy.
Yeah, thank you.
Thank you.